All right, hey everyone, welcome in. Brian here, and we are about to take a deep dive into something I bet you have in your medicine cabinet right now. We're talking castor oil.
I'm Chelsea, and I'm excited to dig into the science and history of this, honestly, kind of a mysterious oil.
Yeah, mysterious is a good word for it.
Hmm.
And Chelsea, when it comes to nutrition, you could say she's got like an encyclopedia in her head. Seriously, she knows her stuff.
Oh, stop it.
And today she's going to help us break down all the info on castor oil from some really great articles from WebMD and Medical News Today that you guys send in.
Love it. And for those of you who haven't joined us for a deep dive before, this is where we take all the complicated stuff you're interested in and give you the need-to-know, most interesting bits. Saves you a ton of time.
Right. And if you're into this whole deep dive thing, make sure you check out the Detox Health YouTube channel. Tons more great stuff over there.
So for today's deep dive, we're going to give you the full picture on castor oil, where it comes from, how people have used it throughout history, what the science says about its benefits, and really important, what to watch out for if you're thinking about using it.
Sounds good to me. So, Chelsea, let's start with the basics. What exactly is castor oil?
Well, it's a vegetable oil that comes from the seeds of the castor bean plant. The fancy scientific name for that is Ricinus communis. It's a pretty unique oil, very thick, almost like sticky, and it usually doesn't really have a strong smell.
Interesting. And it sounds like it's been around forever. The articles mentioned it being used way back in the day.
Oh yeah, way back, like ancient Egypt, way back. And they weren't just using it for health back then either. Get this, they even used it as fuel for lamps.
No way.
Yeah. Plus it had medicinal uses and people used it in beauty routines. There's even a story that Cleopatra used to use it to make the whites of her eyes brighter.
Wow. So from lamps to Cleopatra's eyes, that's pretty wild. Is it still as popular today?
Definitely. Though people are using it for different things now. Today you'll probably see it in laxatives or in skin and hair products. And get this, it's even in things like motor oil.
Motor oil. Wow, didn't expect that. Shows you how many uses it really has.
Totally. And when it comes to health, the FDA has said it's safe and effective for constipation when you need it. But a lot of those other traditional uses, scientists are still studying them.
I gotcha. So where's most of the castor oil we use today coming from?
Right now, most of the world's castor oil is actually produced in India.
Makes sense. Now, I know we don't usually eat castor oil, but the articles did mention its nutritional makeup just for context. What's the deal with that?
Exactly. You wouldn't really eat it because of the taste and because it's mainly used as a laxative in small amounts. But if we're looking at the nutrition, 1 tablespoon has about 120 calories, all from fat. That's 14 grams of fat, no protein, no carbs, no fiber, no sugar.
Wow, so it's basically pure fat.
Yeah, pretty much. It does have some vitamin E, a little bit of omega-9 and omega-6 fatty acids too. But the really important part, the one that's probably doing most of the work, is called ricinoleic acid.
Ricinoleic acid, that's the star of the show then.
It is. Ricinoleic acid is a type of fatty acid, and it makes up a huge part of castor oil. It's got this special structure that scientists think is responsible for all those different things castor oil can do, though, to be honest, we're still figuring out exactly how it all works.
Right, okay, so let's get into the benefits. The one that's FDA approved, like we talked about, is for constipation. So how does castor oil actually help with that?
It all comes down to that ricinoleic acid. When you take castor oil by mouth, this ricinoleic acid, it attaches to receptors in your intestines. And that makes the muscles in your intestinal walls start squeezing or contracting more. You can imagine your intestines like a pipe that's gotten a little slow, and ricinoleic acid comes along and gives it a poke, like, hey, let's get things moving.
Ah, so it's like giving your digestion a little boost. I also saw that it can be used to, like, clean things out before a colonoscopy or something.
Yeah, sometimes it's used for bowel prep before procedures like that so the doctor can see everything clearly. But a lot of times doctors will have prescription laxatives they like better for that kind of thing because they're a bit more predictable and they can control the effects better.
Yeah, that makes sense. So what about using castor oil all the time for constipation? Is that okay?
The articles were pretty clear on this one. Don't do it. It's only meant for those times when you're constipated every now and then. Using it too much can actually cause some not-so-fun side effects, like cramps and bloating. If you're dealing with constipation all the time, it's super important to talk to your doctor to figure out what's causing it and find a solution that works for you long-term.
Good to know. One of the other traditional uses that I found super interesting was for inducing labor. I was surprised to see how common it used to be, especially with midwives.
It's true, it's got a long history of being used that way. The WebMD article even mentioned this survey from 1999, where something like 93% of midwives in the U.S. said they used castor oil for labor induction.
Wow, 93%. That's a lot.
Mm-hmm.
But is there any evidence to show it actually works?
To be honest, the research on castor oil for inducing labor is kind of all over the place. Some studies say it might help sometimes, but others don't really see a clear benefit.
So not a sure thing then. And what's the most important thing for anyone who's pregnant to know about this?
If you are pregnant, please, please do not use castor oil to try and induce labor without talking to your doctor first and having them supervise it closely if they even think it's a good idea for you. It's just not worth the risk. You always need professional medical advice when it comes to something this important.
Absolute safety first, for sure. Okay, let's move on to another potential benefit that was mentioned in the article's anti-inflammatory effects. There was some cool stuff about animal studies and even a human study that was mentioned.
Yeah, the stuff with the animals is interesting. It seems like when they put ricinoleic acid on the skin, it helps with swelling and pain from inflammation. And that human study you mentioned, they looked at people with knee arthritis, and they found that castor oil was actually as effective as a regular NSAI, those over-the-counter pain relievers, for helping with their symptoms.
Really? That's fascinating. But the articles also said not to get too excited just from that one study, right?
Yeah, exactly. While it's promising, both articles said we need a lot more research with people, like bigger studies with diverse groups, to really figure out how strong these anti-inflammatory effects are and the best ways to use castor oil for them.
So more to learn on that front. Okay, how about wound healing? That seems like another area where castor oil might be helpful.
It might. Castor oil has this natural ability to fight off bacteria and other microbes. So that could be helpful with wound healing by preventing infections. And the thought is that it might create this barrier over the wound and keep it moist, which helps the skin heal better. And, you guessed it, that ricinoleic acid probably helps with inflammation around the wound too.
Right. WebMD talked about a specific ointment that has castor oil called Venilix. What's the story with that?
So Venilix is a prescription ointment that actually has castor oil and this other ingredient called balsam Peru. And it's used in places like doctors' offices and hospitals to help treat certain skin wounds and pressure ulcers.
Ah, okay. So not really something you'd use at home for a little cut or scrape then.
Exactly, you wouldn't use it at home. When it comes to wound care, castor oil is more for those serious situations, and you'd always want a doctor to be involved.
Gotcha. All right, let's switch gears and talk skincare. Castor oil seems to be really popular for that. The article specifically mentioned its moisturizing properties.
Yep. Castor oil has a ton of fatty acids, and that makes it a great emollient. Emollients basically seal in moisture to your skin, making it feel soft and smooth. That's why it's in so many lotions, cleansers, all that stuff.
And what about just using pure castor oil straight from the bottle?
You totally can. The nice thing about using it pure is that it doesn't have added perfumes or dyes, which can be good for people with sensitive skin, but it's super thick, and it can actually irritate some people's skin. So diluting it with another oil, like coconut oil or jojoba oil, is probably a good idea.
Good tip. Now, I've seen a lot about using castor oil for acne online. What's your take on that?
Okay, so some people think those things we talked about, like the antibacterial, anti-inflammatory, and moisturizing properties, could help with acne. But to be honest, there's not a lot of research to back that up. It's more like people sharing their own experiences rather than scientific studies proving it.
So jury's still out on that one. How about hair growth? That's another one you hear a lot about.
Oh, yeah. People market castor oil as this, miracle cure for all sorts of hair problems. Dry scalp, hair loss, even dandruff. And it's true, because it's an oil, it can help to moisturize your scalp and hair. But there's no real scientific proof that it actually helps with dandruff or makes your hair grow faster. In fact, WebMD even mentioned this rare but kind of scary thing called hair felting, where the hair gets so tangled you have to cut it off.
Yikes, that sounds intense. Okay, so maybe not the miracle hair grower people think it is. Now, this one's a little out there. The articles mentioned applying castor oil to your belly button. What's up with that?
That's actually from Ayurvedic tradition. They believe there's this gland called the Pichoti gland near your belly button that can absorb things like essential oils. But the thing is, modern science hasn't actually found this gland.
So in reality,
It's probably not doing anything special, but for most people, it's not going to hurt either.
all right, last one on the list, castor oil packs. What are those all about?
Castor oil packs are basically a piece of cloth, usually cotton or wool, soaked in castor oil and then put on your skin. Some people put a heating pad on top of it, too. People use them for a whole bunch of reasons: constipation, dry skin, arthritis, even period cramps, you name it.
Wow, that's a lot. So do they work?
The problem is there isn't much research specifically on castor oil packs.
Mm-hmm.
The heat from the heating pad might feel good, but we just don't have enough evidence to say for sure what the castor oil itself is doing.
Gotcha. Okay, we've covered a lot about what castor oil can do. By the way, if you guys are digging this whole deep dive on castor oil, I just want to give a quick shout out to the Detox Health YouTube channel. We got tons more explorations like this into all kinds of health and wellness stuff. So if you haven't already, hit that subscribe button so you don't miss out.
Now we got to talk about the potential downsides of castor oil. Even though it's natural, there are some things you need to be careful about.
Right, for sure. What are some of the big ones?
Well, one is that you could have an allergic reaction. If you're allergic to the castor plant, you might get itchy, swollen, or get a rash if you put castor oil on your skin. That's why it's a good idea to do a patch test first. Just put a little bit on a small area of skin and see what happens.
That's a good tip. What about taking it for constipation? Any side effects there?
Yeah, like we said earlier, if you take too much castor oil, it can mess with your stomach. You might feel nauseous, get cramps, throw up, feel bloated, even get dizzy. It's really important to follow the directions and talk to your doctor if you have any questions before using it.
And we talked about pregnancy before, but it's worth repeating the risks.
Definitely. Because castor oil can cause contractions in the uterus, it's a no-go during pregnancy unless your doctor specifically says it's okay and they're keeping a close eye on you.
Wow.
There's also not enough research to know if it's safe when breastfeeding or for babies and kids, so better to be safe than sorry.
Yeah, agreed. Now, what about if someone's taking other medications? Any interactions to worry about?
Good question. If you're using castor oil as a laxative, it's usually best to take it a few hours before or after any other medications. That's because laxatives can sometimes affect how your body absorbs those medications. And it's generally not a good idea to mix castor oil with other laxatives or those water pills, diuretics, unless your doctor tells you to.
Okay, good advice. And what if someone accidentally takes way too much, like overdoses?
Overdosing on castor oil can cause some pretty serious problems like bad cramps, chest pain, really bad diarrhea, dizziness, rash, and even trouble breathing. If any of that happens, call poison control or get to a doctor right away.
And even though castor oil isn't as toxic as the raw castor beans, we got to remember that it can still be dangerous for pets if they eat too much of it.
True. It's not as bad as the raw beans, but if your pet eats a lot of castor oil, it can give them stomach problems. So always keep it out of their reach. And if you think your pet might have gotten into it, call your vet right away.
Yeah, always good to be safe. Besides the general skin irritation, are there any other skin-related things people should watch out for?
Yeah, so on top of the general irritation, some people who have really sensitive skin can actually get allergic contact dermatitis. Sometimes it happens on the lips if they use lip balm with castor oil in it. And in rare cases, there's this really serious allergic reaction called anaphylaxis.
Anaphylaxis, that sounds serious. What are the signs of that?
It's a life-threatening allergic reaction that can happen super fast. You might get hives, swelling in your face or mouth, start wheezing or having trouble breathing. Your heart might race. Your skin could get clammy. You might feel anxious or confused, dizzy. You might throw up. Your lips might turn blue or white. You could even faint or pass out. If any of that happens, it's an emergency. You need medical help fast. If you have an EpiPen, use it and call 911.
Wow, good to know. Thanks. WebMD also had a couple of FAQs that might be helpful for our listeners. One was about using castor oil as lube.
So, from what I read, it might be safe for some people, but it's not a good idea for everyone. Castor oil can actually break down latex and polyisoprene, which are materials used in condoms, dental dams, and diaphragms, which means they might not work as well to prevent STIs in pregnancy.
So definitely not the safest option for everyone, especially if you're relying on those barrier methods for protection. And the other FAQ was about drinking castor oil every day.
Right. Like we've been saying, the FDA only approves castor oil for constipation every once in a while. It's not meant to be taken every day long term.
Gotcha. Okay, Chelsea, we've really covered a lot about castor oil. So if you're listening, what are the main things you should remember?
To sum it up, castor oil has a long history, and the FDA has approved it for constipation when you need it. It also looks promising as a moisturizer for skin and hair. But the important thing is there's not enough evidence yet for a lot of the other stuff people say it does, like making hair grow or clearing up acne. We need more research.
Exactly. And what's the most important thing for anyone thinking about using castor oil to know?
Hands down, talk to your doctor or another healthcare professional before using castor oil for any health reason. They can give you the best advice for your situation and help you understand the risks and benefits.
That's the best advice right there, for sure. So, Chelsea, thinking about all the different ways people have used castor oil throughout history and how we're still learning about it, it makes you wonder what else we might discover about it, right? I mean, what if more of those traditional uses turn out to be true? It could really change the way we think about health and wellness. Definitely something to think about.
Totally. It's always fascinating to see how traditional knowledge and modern science come together. Castor oil is a great example of that.
Couldn't agree more. Well, that about wraps up our deep dive into the world of castor oil. Thanks so much for sharing all your knowledge with us today, Chelsea. And thank you for listening. If you enjoyed this deep dive, don't forget to subscribe to the Detox Health YouTube channel for more great content. See you next time.